Hello, my name is Riley McFarland, and the situation I chose to create this video on is helping training nursing students and medical students on transgender identities and how to work with them respectfully and compassionately in the medical field. So to start this conversation on transgender identities, I think one of the main important things is to be able to identify the difference between sex and gender, because a lot of the time they are associated as the same thing when they are in reality very different. But when learning the difference between sex and gender, we can start with sex. Sex refers to biological characteristics, mainly of female and males. This refers to reproductive organs, chromosomes, hormones, things that biologically you are born with. So gender can be a lot harder for people to understand. And this is, I would say, is because it's a social construction and we as a society made this up and assigned these rules for people to follow. So thinking about this, we can think about social norms and roles, clothing, colors, what you are allowed to do and what you're not based off your sex. So for clothing, we can start with, this is an easy one. We all know that men and women are expected to dress differently. Women are expected and allowed to wear skirts, dresses, high heels, or it goes into makeup, having their nails done, while men are not typically allowed to wear these kind of things or express themselves in that way. They are told to wear suits, pants, ties, short hair, that kind of thing. This goes into how we express ourselves emotionally as a big one. While women are said that they are more emotional than men and are more allowed to express their emotions, well, that is not true that women have more emotions than men do. We're just trained to be able to express those emotions, while men are trained to hold them in and not talk about it. But now that we know the difference between gender and sex and how gender is associated with certain sexes, we can get into what transgender people are and who they are and what that means. So transgender people are people whose gender identities don't match what is typically associated with their assigned sex at birth. So we want to get into why this is important in the medical field. There can be a lot of issues with being transgender and what happens mentally and physically. So while a lot of transgender people do wish to transition in a way of expressing themselves as a different gender and sex, but this is not necessary criteria to be transgender. So to get into this, a lot of the time being transgender comes with gender dysphoria. This is a distress that a person experiences when their gender identity and expression does not match their assigned sex at birth. So there's a lot of mental battle that can happen with that, especially if people are not being respectful of preferred pronouns, and just letting them express themselves in the way that they need to. We can now go into what it means to medically transition. Medical transitioning is not necessary to have a valid transgender identity, but it can help with gender dysphoria. A lot of the times medical transition starts with hormonal treatments. This would be transgender women taking in estrogen and transgender men taking in testosterone. These can be administered by injections, there's patches, there's creams, there's many ways you can administer hormones into the body. There's another step that individuals can take, and this is through surgical interventions. A lot of the times this can include changing outside reproductive organs and making them into the different sex that you identify as. But this is not always the case, and people do not have to always do this if they choose not to. There's also you can do facial reconstruction surgery to make your face more masculine or feminine. There's many different things people can do to help battle gender dysphoria. Like I said, medically transitioning is not necessary for transgender individuals, but it can be life-saving. This is why it is so important to learn about these and to respect individuals who come in wanting these medical transitions done. So, to avoid discrimination is refusing to help a transgender individual transition medically if that is what they are coming to you for. For prejudice, these are negative attitudes and beliefs towards individuals who are transgender, such as in being uncomfortable around them, not letting them share experiences, not allowing them to be in their preferred bathrooms. Microaggressions often aren't recognized by society. Examples of this is using non-affirming language towards individuals, not using preferred pronouns for them, making offensive questions, such as asking if they plan on medically transitioning in any way that they have not brought up. And these are just many reasons why it is important to respect transgender men and transgender women in a medical setting. You need to use their preferred names and pronouns. Don't ask personal questions. Do not pressure for surgeries or hormonal interventions. And do not ask about body parts that they have, what they were born as. These are all very highly offensive questions and conversations to initiate with transgender individuals. And I hope that you can use this lecture as a way to navigate your time in the medical field and how to be respectful to patients.